The problem Jacob, Anna, and I, Victoria, will be discussing is lung cancer and its relation to smoking, and we're Group 6. Lung cancer is the leading cause of cancer death worldwide, and more than 50% of people with lung cancer die within 1 year of being diagnosed. Smoking tobacco is the primary cause of lung cancer and accounts for 90% of lung cancer diagnosis. The more years a person smokes and the more cigarettes smoked each day contributes to the increased risk of lung cancer. People who smoke cigarettes are 15 to 30 times more likely to get lung cancer or die from it in comparison to those who do not smoke. Quitting smoking at any age can lower the risk of lung cancer. Those with lung cancer are more commonly affected if they smoke tobacco and are higher in age, i.e., those 65 and over. As of 2022, the UK has 33 cases of lung cancer per 100,000 people, while the United States has 35 cases per 100,000 people. Of those in the UK, 79% with lung cancer smoked, and of those in the US, 90% of those with lung cancer smoked. The risk factors of lung cancer include tobacco use, which is the number one risk factor and cause of lung disease, environmental conditions such as secondhand smoking or being exposed to radon, a natural gas that can seep into homes and buildings through cracks and holes, and age.
In order to deal with this issue, policymakers have enacted tax laws and restrictions on tobacco use and purchases. On December 20th, 2019, the age of purchasing and smoking tobacco was raised from 18 to 21 by Donald Trump, amending the Federal Food, Drug, and Cosmetic Act. There have always been federal taxes on tobacco, and the most recent increase on these products was on April 1st, 2009, as there was an increase in 62 cents or $1.01 per pack. On June 22, 2009, President Obama signed the Family Smoking Prevention and Tobacco Control Act, putting restrictions on marketing and enforcing more intense health warnings on these products. States also have their own laws on taxing tobacco, and it can range from a couple of cents to a couple of dollars per pack. Recently, in states like California, there have been bans on selling flavored tobacco products in order to decrease the usage by adults and especially youth. This was done in November during the national election with Proposition 13 for California. Other states like New York, New Jersey, Rhode Island, and Massachusetts have already enacted similar bans. There is targeted screening for lung cancer through low-dose CT scans. Those recommended to seek screening are those between the ages of 50 to 80, those who have a 20-pack year or more smoking history, and those who smoke now or have quit within the last 15 years. There are some risks with screening, such as a false positive result, overdiagnosis of a non-harmful tumor, and radiation from the CT scan. Continuing forward, we need to increase taxes on tobacco, continue flavored tobacco bans in other states, and continue anti-tobacco ads and stop advertisements for tobacco products. By doing this, we can try to eradicate the amount of preventable deaths in the U.S. by lung cancer and smoking tobacco.
The CDC has information available to the public which is accessible by anyone because it is on the internet. This information is accessible through the internet as it was one of the very first few Google results that came up after searching up lung cancer smoking. People can seek care for smoking-related lung cancer with their primary doctors, who can then refer them to an oncologist and possibly also a pulmonologist. An oncologist specializes in cancers, while a pulmonologist focuses on diseases of the lungs. There are a few misconceptions that come with smoking-related lung cancer, and one of them is that only people who smoke get lung cancer. The truth is that anyone can get lung cancer. While it's true that tobacco use is the leading cause of lung cancer, people who have never smoked can also be diagnosed with lung cancer. Healthcare workers make sure to always emphasize that secondhand smoking can also be dangerous and that there are other ways to get lung cancer. Another myth is that if you've been diagnosed with lung cancer, there's no point in quitting smoking now. The truth is that quitting smoking after a lung cancer diagnosis can benefit your cancer treatment and recovery. Healthcare workers always can promote stopping smoking by having talks with their patients, making sure misconceptions are just that. They also help by printing out informationals and spreading the word on the harms of tobacco smoking on the lungs. Another myth is that there's nothing you can do for advanced lung cancer. The truth is that effective treatments for advanced lung cancers are now available. These can be explained as options for patients, even those who may not have lung cancer due to smoking. One last myth is that there isn't a way to find lung cancer before it starts to cause symptoms. The truth is that lung cancer screening is available and recommended for people at a high risk for the disease. Again, being open with this conversation is an important way that healthcare workers can help with this problem and its misconceptions.